We interrupt this program for breaking news from the Global National Newsroom.
Good morning. Thanks for joining us on TV or online. I'm Colleen Christie. We are waiting for Prime Minister Justin Trudeau to update Canadians on Canada's response to the COVID-19 crisis. He is set to walk out of the door of Rideau Cottage in Ottawa in about 15 minutes. He's continuing to work from home more than 2 weeks after his wife tested positive for COVID-19. Medical professionals have now given Sophie Gregoire Trudeau a clean bill of health. She posted a message on Instagram thanking people for their support and encouraging all Canadians to stick together at a distance through this crisis.
I know that it's all good for me now, but there are many, many Canadians and many people who are suffering right now. And I want to send you all my love, all my courage. We're going through some really rough times, really difficult times, and we're going to stick through it together.
Of course, one of more than 400 people in this country who have recovered from the illness. All told, there are nearly 6,000 cases of COVID-19 across Canada. Nowhere in the country hit harder than Quebec, which now has approximately 2,500 cases. Ontario announced 211 more cases this morning. There are now more than 1,300 cases in that province. BC, Alberta, Saskatchewan, Nova Scotia, and Newfoundland are among the provinces reporting higher number of cases. Nunavut is the only province or territory without a confirmed case. Now, sadly, at least 61 people have died. As we wait for the Prime Minister to speak, we're going to speak with some of our correspondents who have been covering the COVID-19 pandemic extensively. First, let's go to our Mike Lecouture in Ottawa. Mike, what are we expecting to hear from the Prime Minister this morning?
Well, we expect him to hear a little bit about new money that he will announce for programs to help people who are most vulnerable. He's talked a lot about youth and seniors and the difficulty that they are facing and trying to make sure that they stay healthy. And of course, we know that in the elderly that this virus is most fatal. So they want to make sure that they're targeting that as well. We saw last week, how much was announced and where it was targeted. And I think now the Prime Minister and this government knows that they have to sort of announce different envelopes within that big amount of the $107 billion that passed through Parliament. And a lot of it, I think, is to communicate to Canadians so that they feel reassured. I mean, Colleen, I know, when we're out and about talking to friends, a lot of people have a lot of questions about it. So the communication aspect of this with this government has been key. They want to make sure that they're constantly talking to Canadians. That's why you're seeing the Prime Minister for, I think it's going on at least 14 days straight now that he's spoken. It's at least for the duration of his self-isolation that he has made sure that he comes out of Rideau Cottage and talks to people to ensure that they understand what is going on, because information is key. Interesting to note as well, we were speaking this morning on the West Block, taping some of that for the show later on today that you'll see this evening, speaking to Minister Baines, who's the Minister of Innovation, Science and Industry, exactly on all of the equipment, because that announcement was made at the beginning of the week, the production of equipment. We also heard at the end of this week on Friday that the manufacturers of auto parts in Ontario have partnered with the Ontario government to try and scale that up. The federal government is also trying to partner with companies, and it's not like the U.S., like where you had Donald Trump order General Motors to make ventilators. In Canada, they're really trying to go with the collaborative effort, and have a listen now to Minister Baines on how that's going.
Oh, they're stepping up. They're stepping up in a big way. They are mobilizing. They are building these essential supplies for us. So there's no order that's required. The level of cooperation is there. The goodwill is there. And we're working around the clock to do this.
I can't help but think one of the issues I'm concerned about for Canadians is they've been given some information about efforts to help them financially, and that has been a big sigh of relief for many people. But the question is when.
Yeah, and that's the big issue that even this government has been grappling with. You saw Finance Minister Bill Morneau when he was questioned about this in the Senate earlier this week, and they basically said, do you have the infrastructure within government to make sure that this gets out the door? And he admitted, look, our system was not built for this kind of stress and strain to get this much money out the door this quickly. We were hearing that April 6th is the earliest that portal to apply for EI would be open. The Prime Minister had said then 10 days following that, they are hoping that people will have money in their bank accounts, in their pockets. But this is all best case scenario. And of course, in this time, it's difficult to predict best case or even worst case scenario, whether or not there'll be a glitch in trying to set all of this up. So I think the government is trying to temper expectations while at the same time giving people firm dates so that people can have that kind of ray of hope. Don't forget, this is going to be the time right around now where people who are laid off or people who have seen reduced hours will start to see those bills coming in the mail or popping up in their inbox that they have to make rent, that they have to make credit card payments and try and actually pay those bills, because those things don't stop. We keep living, even though there have been some deferrals and, depending on the province or jurisdiction, there have been some sort of mortgage or rent deferrals. But at the same time, Canadians are wondering when that money will be there. And the difficulty is that the government is trying to work as quickly as they can. The Prime Minister said 1,300 more civil servants will be on the job doing this, trying to get the money out the door. The difficulty is if everybody's in self-isolation, government is not working as it normally does. It's not at the same capacity, but there's an effort anyways on the part of the government to make sure that the civil servants and the civil service as a whole is trying to ramp back up to help so many Canadians who are in need right now, Colleen. And
patience is required from everybody. April 1st is on Wednesday. All right. We're going to check in with you in just a few minutes. Thanks so much, Mike. Our Ottawa Bureau Chief, Mercedes Stevenson, is working from home, as she has been for some while. Mercedes, we are still seeing a lack of detail on the business aspect of the financial aid package.
Yeah, there's still a lot of questions that businesses have, and certainly they welcome the news that there was going to be that 75% wage supplement, which will allow companies hopefully to not have to lay people off. They'll only have to be paying 25% of the wages. The Prime Minister took the unusual step of also asking those companies to consider hiring people back who have been laid off. But there's still questions, Colleen, about exactly which businesses will qualify for what, about those loans that the government talked about, up to $40,000 for storefront businesses. What is a medium or small sized business? Where is the cutoff there? So there's still a lot of questions that I'm hearing from people who run their own businesses, from people who have small businesses or work for medium sized businesses, and they're trying to find that out.
Well, and it's fine to say that renters, for example, don't have to pay, won't be kicked out of their homes if they don't pay their rent, and that help is coming there. But then there are the people who hold the mortgages and the people who run the businesses who pay the people who hold the mortgages. It is definitely a trickle-down situation. Mercedes, we're expecting to hear the Prime Minister talk about help for seniors today. A lot of seniors are anxious about what is going to be done for them. And one of the problems, of course, the stock market crashed. And seniors don't often have the tech savvy that younger people do to access programs that are online.
Yeah, you hit on so many important points there, Colleen. And I'm getting emails from a lot of seniors who that's really what they use. They use email and sometimes the internet, but they're not of the younger generation that's constantly on their phones or super cyber savvy when it comes to putting in applications. And they're worried about a few things. First of all, we haven't heard from the Prime Minister what we are expecting to hear today. And that's what's going to be done for vulnerable groups like seniors and youth who don't often have the same income levels as those who are in the workforce and sort of in their middle age and at the prime of their careers. And I've gotten so many emails from people who have retired, who are relying on their savings, who are really concerned. They've carefully saved, they've put that money away. They are now seeing those savings drop because of what's happening in the markets, and they're not sure how they're going to be able to pay their bills or what happens if they can't. And these are not people who will be able to go out and simply apply and try to get a job after the financial crisis of this resolves. They are people who are in their golden years and they need to stay in retirement. Some are not able to work. Some have disabilities or illnesses on top of being seniors, which makes it very difficult. So we'll find out some details today about what the government has planned for groups like that. The challenge, as you mentioned there, though, is how to access the benefits even once they're announced, because those storefront Service Canada centres that people were going to talk to an agent, to get help, those have closed down. And that is what a lot of seniors relied upon to be able to make applications or to ask questions that they have. They're trying to encourage people to go online and do it that way, which is understandable in the sense that there is a huge number, a huge unprecedented volume of applications, and most of their workforce is at home. But a lot of seniors are saying, I don't know how to do that. I'm not comfortable with doing it. You can't just have a child or a grandchild come over to help you now because of social distancing. So we'll have to see what the government's going to do to make sure that that application process is accessible for seniors who don't use internet, lower income people who don't have internet at home and don't have that capability, to make sure that they're not being left out simply by the platform being used to create these applications.
Mercedes, we've been hearing a lot about the role of the military in the U.S. right now. What about here in Canada?
So the military here is absolutely preparing should they be called upon. In fact, the Chief of the Defence Staff, General Jonathan Vance, sent a letter out to the troops on Friday. I've never seen anything like this. It was a 5-page letter that had a number of really interesting points in it. Number one, they've changed most troops' point of duty, where they report to in the day, to their home, because they don't want them in at work. They're also warning them to prepare to be essentially on a war footing to activate very, very quickly across the country should cities, provinces, or the federal government ask for their help. In particular, they're looking at things like how would they help manage the logistics of thousands of patients who need attention if the hospitals start to become overwhelmed? What can military medics and doctors do? What kind of tents could potentially be set up to look after people, or facilities converted that the military would help with? What about evacuating people from remote areas who might be under threat? So they're looking at all of those things right now, but we also know they expect to be under significant strain, because the Chief of the Defence Staff did something very unusual in this letter. He asked people who are currently retiring to reconsider leaving the forces until this is over. And that's because the military, Colleen, might have to deal with COVID-19 at the same time as things like wildfires and spring floods that we've seen in the past.
Well, the world does not stop turning because of COVID-19. All right, thanks so much, Mercedes. Even as countries take drastic steps to prevent the spread, cases of COVID-19 are still rising sharply in many parts of the world. First to the U.S., where there are no signs of the curve flattening. It is the epicenter of this pandemic, with more than 122,000 cases. Worldwide, more than 680,000 people have been infected since the outbreak. More than 30,000 people have died. 1/3 of those deaths have been in Italy, which is the country which has had more deaths than any other. Italy has recorded more than 92,000 cases of COVID-19 so far. Spain has also been hard hit by the new coronavirus. The country reported its single highest day death toll overnight. Our Redmond Shannon is watching that and all of the developments in Europe right now from London. Redmond, what can you tell us?
Good morning, Colleen. Well, yes, as you say, Spain hit almost as badly as Italy has been struggling to get to grips with this crisis. And that overnight death toll in Spain was 838, bringing the death toll in Spain to 6,500. Those figures really are hard to get your head around when you're talking about deaths, not cases. 6,500 deaths in Spain and more than 10,000 deaths in Italy. We expect, sadly, a number of hundreds of deaths in Italy to be added to that later today when those figures come out. The UK has just upped its death toll from around 1,000 to over 1,200. France sitting at 2,300. And let's not forget, outside Europe, the country being affected the most, apart from, of course, the US and China, would be Iran, where 2,600 people have died. So the numbers really are mind-blowing when you think about the human cost and the struggle that these countries are going through just to process, just to deal with these funerals and to give these people who pass away the burial that they deserve. And sometimes that is simply just not possible.
Redmond, before the Prime Minister speaks, I understand the Prime Minister of Great Britain has released or sent a letter to all 30 million households in the UK?
Yeah, that's right. So a letter is going out. It has 10 Downing Street, the Prime Minister's office here in the UK. Boris Johnson tweeted it out this morning. That letter with one message really in it, that physical letter will go to 30 million households in the UK, and that is stay home. And there are new measures being rolled out across the UK that include fines that will be going up to about $1,600, $1,700 worth of fines for individuals, and maybe $8,000 or $9,000 in fines potentially for businesses who break the rules about the current lockdown situation in the UK. The UK government yesterday came out again and said that really the best possible scenario it is expecting now in terms of the number of people who may die in the UK is 20,000. That's an absolute minimum. Now, currently the UK is sitting at around 1,200, so the peak is perhaps a few weeks from now in the UK, but the peak is coming and they expect that it will be maybe 2 weeks from now.
Redmond, thank you so much. The Prime Minister is about to speak. Let's listen in.
Bonjour tout le monde. Le mois qui vient de passer a vraiment été très difficile.
The past month has been very difficult for many people, and I understand that. We're doing everything we can to help you. This week, we announced new measures for families, workers, and businesses. Even with this, I know that times are hard. And for those who were already having a hard time, it's even worse. Staying home, for example, is not always an easy thing to do.
Means juggling taking care of the kids while trying to get some work done at the kitchen table. But frankly, that's not everyone's reality. For far too many people, home isn't a safe place to be. For others, it's somewhere they're isolated and alone. And for too many more, they have no place to go at all. Tough times fall first and hardest on the most vulnerable in our communities. But we can change that. We can make sure that no one is left without help. Let me take a moment to speak directly to kids. I know these past weeks have been tough. You haven't seen your friends, you're not able to go to school, you've been hunkered down with your parents, and you're watching the world you know change radically. It's a source of anxiety, it's a source of tension. Maybe there's extra tension in your family. But there are people who can help. Reach out to Kids Help Phone. You can call them or text them. Text at 686868 or call 1-800-668-6868 or go online to kidshelpphone.ca. They are there to listen. They are there to support you. They are there to make sure that you know that you are not alone and help you and all of us through this. No matter where you live, 24 hours a day, 7 days a week, in French and in English. Indeed, to make sure that you have the help you need, we're investing $7.5 million for more counselors and trained volunteers with Kids Help Phone. There are people in your corner making sure you're okay. And kids, I want to speak with your grandparents now. Our seniors are particularly vulnerable to COVID-19. We all know that, and it's for them that so many of us are staying home, are self-isolating, are following the rules. But even if they're safe and isolated, this is not easy on them. Maybe they're having trouble getting out to get groceries. Maybe they're feeling particularly alone. Maybe they've already been isolated and this is just an extra degree of stress on them. Well, we've got help for them as well. The Minister of Seniors, Deb Schulte, is announcing $9 million through the New Horizons for Seniors program to the United Way for everything from health check-ins to grocery delivery. In fact, the United Way is already stepping up. Here in Ottawa, they're helping people like you with things like meal delivery. Aujourd'hui,
Today, we are announcing help for those who need it the most. I would like to take a moment to speak directly to kids. I know that these past few weeks haven't been easy. for you not to see your friends, not to go to school, to not be able to do the things that you normally do. And the world is changing before your eyes. This is a source of stress and anxiety for you and for your family. Maybe things aren't easy at home. Please know that help is available and that you are not alone. Kids Help Phone is a program that has existed for a long time to help. You can go online, you can call, and you can also text. And the people at Kids Help Phone will help you. You can send a text to 686868, or you can call 1-800-668-6868. Regardless where you are, they can answer in English or in French, 7 days a week, 24 hours a day. Someone will be there to help you and your family. And to even do more to help these youth that need to speak to someone, we are going to invest $7.5 million in Kids Help Phone for counselors and trained volunteers. And now for the grandparents of these young people, we're thinking of you as well. We know that COVID-19 is a greater danger for seniors. You're most likely more isolated. It might be difficult for you to get your groceries and to meet your essential needs. Additional help is on the way for you as well. To help vulnerable people and seniors, we're going to provide $9 million to the New Horizons for Seniors program through United Way. This will allow the organization to provide different services to seniors, whether it be checking on their health or meal delivery or grocery delivery. In a country such as Canada, no one should be left aside. And to help those who are homeless, people who are fleeing domestic violence, we are going to spend $200 million on shelters.
Get through this tough time. If you can't go home because it isn't safe or because you don't have a home, we're not going to forget you. We'll work with the organizations you rely on, and we'll have your back. Earlier this month, we committed $200 million for shelters. If you need to get away from domestic violence or violence because of your gender, if you need somewhere to stay, there are places you can go and be safe. This new funding is already having a huge impact on support for you. Just take the shelter in Toronto that can now rent additional space to isolate residents with COVID-19 and keep everyone safe. And we're going to keep working with charities and nonprofits on this. On that note, I want to recognize the incredible people who work and volunteer in their communities through these groups. I know it's been hard lately, not just because more and more people need your help, but because you're struggling to keep doing this work for marginalized and vulnerable people during a public health crisis on a scale that Canada has never before seen. Soon, I'll have more to say about how we can make sure you're supported and can help keep helping Canadians who need it most. But the bottom line is this: whomever you are, whatever you need, we're here for you. And if you're fortunate enough to have a little extra to spare right now, I'm asking you to join in and be part of the solution. Please donate to your favorite organization or find out how you can volunteer in your community. Even working from home, you can make a real difference in the impact an organization can have. As an individual, a family, a company, think of how you can lend a hand to help others through this tough time. On a tous notre rôle à jouer pour assurer notre
We all
santé.
have our role to play to ensure our health and safety. As we're repeating very often, it's very important that people keep a distance of 2 meters between themselves and others, that they stay at home and they avoid crowded places in order to flatten the curve as quickly as possible. I know that it's even more difficult to stay home during the weekend. Sometimes people can feel quite alone. Don't forget that we're all going through this hardship together. If you look around, you will see many signs of solidarity throughout the country and throughout the world. People are putting up rainbows to remind neighbors that better days are yet to come. And if you're in Montreal this evening, look at the Samuel de Champlain Bridge. It will be lit up with the colors of the rainbow.
I know these are hard times, but I also know that we're going to get through them together. Merci beaucoup tout le monde.
Thank you. We'll now go to the phone lines for first question. Please keep it to one question and one follow-up. Operator.
Thank you. Merci. La première question nous vient de Raymond Fillon, TVA. À vous la parole.
Raymond Fillon, TVA.
Oui, bonjour, Monsieur le Premier ministre.
Hello, Mr. Prime Minister. I would like to come back to another subject. Have you received any requests or are discussions underway so that the Canadian Army will intervene? I'm thinking of Quebec, where they're speaking of closing access to the city of Montreal. We know that the situation is quickly evolving, and we are prepared for different scenarios. Canadians know that the Canadian Armed Forces are there to help when Canada is in need. They will be there to serve. Right now, we have not received any specific requests. There are no plans underway to have the Army intervene.
In a follow-up, right?
You said on Friday that you intend to stay at home, even if you and your family are now healthy. Is this to show the example? Many people are saying, well, you're the leader of the government of Canada. Can you be as efficient during this crisis by working at home? We're very pleased that Sophie has been given the green light. She has been symptom-free for a few days. She went to Harrington with the children. I continue to working from Rideau Cottage. Many people have been asked to work at home. If you think about it, I was in the same house with a person who up until a few days ago was diagnosed positive with COVID-19. And so the countdown will continue because theoretically I could have got it a few days ago. So I'm going to continue to self-isolate. Health Canada is asking us to do this. That's a recommendation. This is something that we're asking citizens to do as well, to stay home when it's possible. And as you can see, I continue to work each and every day. I work from home, and we're able to coordinate things and to do the necessary work.
First of all, I'm very happy, as many people were, to see that Sophie has been given the all clear. It's been a few days since she's been symptom-free. And obviously, I want to thank everyone who's sent messages of support. She's taken the kids to Harrington. I'm going to continue to stay here to do the work that needs to be done. And if you think about it, people are wondering why I'm still in isolation. Up to a few days before she was clear, I was still sharing a roof. We were being careful, but sharing a roof with someone who'd tested positive for COVID-19. So I have to continue in isolation in order to be sure that we're following all the protocols and the recommendations by Health Canada. The work that we're doing continues as a government. There are lots of companies and organizations around the country who are discovering that you can do an awful lot of work via telephone, via video conferences, and that's exactly what I'm doing, and I will continue to do it as so many Canadians are as well.
Thank you. Next question, operator.
Merci. Thank you. The next question is from Mia Rabson, the Canadian Press. Your line is open.
I'm wondering if you could talk a little bit more about what aid and help you will be providing to charities. I know several hundred of them made a plea last week for help to be able to continue. I think you hinted that there is something coming. Can you give some more reassurances that the charities that are being so relied upon right now will get some help?
Today we have announcements for charitable and nonprofit organizations specifically that have been doing a great work helping out our youth and our seniors, but we recognize there's much more to do. Not only are organizations in the charitable sector and the nonprofit sector doing incredibly important work during very difficult times, they're also in many cases seeing their donations dry up and are very worried about their capacity to continue to do the work they're doing. That's why we're working closely with them, and we'll have announcements to make in the coming days about how we're going to ensure that they can continue to do this incredible work that is so important for Canadians.
And a follow-up, Mia?
Yeah, I'm also wondering, are you concerned at all that you're putting too much pressure on airline staff, check-in staff, people at the train stations to screen people for COVID-19?
We already know that an awful lot of people are not traveling, have listened to the recommendations to stay home, to avoid non-essential travel. This is extremely important. And from the very beginning, we told people that if you have COVID-19 symptoms, you need to stay home. You should not travel. You must not go out. That's going to continue to be the instructions we give, but we've also asked airline and train staff to ensure that nobody with symptoms boards their planes or trains.
Thank you. Next question, operator.
Thank you. Merci. Next question. Prochaine question. Lina Dib, La Presse canadienne. À vous la parole.
Oui, bonjour, Monsieur Trudeau.
Hello, Mr. Trudeau.
Ce même sujet, vous dites que vous n'avez pas
You said
de l'armée pour l'instant,
that you don't require the services of the armed forces, but can you expect that this could be useful and necessary when we see what's happening in Quebec? It's a large geographic area, and we need to intercept those who continue to travel. The Canadian Armed Forces are there to help communities and those in need in Canada. We're looking at different possible scenarios where this extra help could be used, but we're not there yet. We're not there today. We're going to continue discussions with the provinces, with different regions, to make sure that we can do what's necessary. We're not closing the door to any possibilities, but we're making decisions as things evolve. Yes, I have another question. Does your 14-day countdown begin today? We're going to continue following the recommendations. I think that that's one way to count it, or even a few days less, because Sophie received the all-clear a few days ago. But we'll keep you apprised to the press conferences that will continue here at Rideau Cottage.
One more call. Operator, please.
Merci. Thank you. Next question, Alex Butler, Toronto Star. Your line is open.
Good morning, Prime Minister. You announced a whole lot of different, funds and measures for small businesses, but a lot of small businesses are having trouble navigating through what you've announced in terms of tax deferrals, wage subsidies, credit availability, that sort of thing. Groups like the CFIB are trying to help them navigate this, but are you considering anything from the federal government to make it easier for people to access the funding that they can access and getting the funding to the right people?
We are doing an awful lot of things that have never been done before by any government in this country. There's never been a reason to. And as we're developing new policy solutions, new ways of helping out people so that we can get through this time and come out the other end of it stronger than ever before, we need to really figure out both what those things are and to ensure that people are going to be able to access them. We are putting out as much information as we can about the different options, and I recommend people go to Canada.ca to be able to find more information about it. I know there are organizations, whether it's the CFIB or banks themselves, that are giving advice around these new measures we're coming in, but we're going to continue to communicate as best we possibly can so that everyone is able to access the help that's there for them, even as we create new ways to help people. I recognize the challenge, and we're going to continue working on it.
And Prime Minister,
Juste une seconde, Alex.
Hang on just a second, Alex. I recognize that we are doing many new things. We have new programs, and it can be difficult to try to find exactly how to obtain the help. This is why we're going to continue to try to give out all the necessary information to citizens, to businesses, so that they can have access to the help that they deserve. We're going to continue working with organizations and even banks to make sure that information on all the help available will be accessible for people who need it.
And your follow-up, Alex?
Prime Minister, there have been numerous reports that prisons are of particular concern. Prisoners are concerned about the measures in place to protect them from the outbreak if it reaches prisons in Canada. Well, what do you say to prisoners who are concerned right now that they're dealing with 1 bar of soap per week and no other countermeasures?
We are very concerned about the fact that our correctional institutions could be places where there could be greater vulnerability to COVID-19. That's why we've been working very closely with Corrections Canada, and I know Minister Bill Blair, Public Safety Minister, will have more to say on this. This is something that we are digging into very carefully because we need to make sure we're keeping everyone safe in this country.
I recognize that our correctional institutions are more vulnerable than other places. This is why we're going to continue to work with Correctional Services Canada and Minister Blair to make sure that we're doing everything so that everyone is safe.
Thank you. We'll now go to questions in the room.
Ian Wood, CTV News. Prime Minister, this morning you made a small announcement with regard to seniors giving money to charity groups there. But what about those that are on fixed incomes, seniors who have watched their investments and their retirement savings dwindle away on the market? Are we going to see any increases to CPP or other provisions for them like you've offered to workers and small businesses?
Our focus right away has been figuring out how to ensure that we can replace sources of income and revenue that have been lost because of COVID-19 for so many Canadians across the country who were relying on their paychecks to get through from week to week until this actually hit. But we recognize that seniors are facing greater vulnerabilities, and we are looking carefully at measures to be able to support them through this tough time as well.
Okay. And the Dutch government has sent back 600,000 masks to China that they deemed were defective. I'm wondering, when will we receive the masks that China has said they're going to send to us, and what assurances do we have that they will be effective? And have we seen a thaw in our relationship with China in the course of this crisis?
We will be receiving equipment, masks and gloves and gowns from China extremely shortly in the coming days. And at the same time, I can assure people that Health Canada has very strong procedures for evaluating, for ensuring that what we get is up to the necessary standards, and there will be no corners cut on this one. We need to make sure that the equipment that our healthcare workers rely on to keep them safe as they keep us safe safe is of a quality that is going to actually do the job. And we're going to continue to engage with the world and try to work collaboratively through this difficult time. It is a global pandemic, and countries need to set aside their differences and work together to get us through this as best possible, and that's certainly the approach that we're taking.
Abigail Beeman, Global News. Prime Minister, in the case of the Quarantine Act and also in the case of the measures announced for travelers yesterday, there's been no clear information about enforcement for those who break the rules. And yesterday in Ontario, we saw a snitch line for price gougers. I'm wondering if you can provide more information about enforcement in general, and also wondering, are you encouraging Canadians to report other Canadians who aren't following the rules to local authorities?
I think, first of all, it's really important that we all follow the rules. What we do today, what we've done over the past few days, what we will be doing over the coming days will have a direct impact on whether or not Canada is able to make it through this crisis in the best possible way. It'll have a direct impact on our healthcare workers. What we are choosing to do right now, these weeks, will affect deeply whether and how we get through this crisis and get out the other side better. So I really impress upon everyone the need to self-isolate, to follow the rules, to make sure that we are not putting ourselves or our neighbors or our communities at risk. Health Canada does follow-ups with people in terms of respecting quarantine. That's an important part of what we do. And I would really encourage Canadians to continue to spread the message, share with each other how important it is to continue to stay home.
I'd also like to ask you to respond to reports that we're hearing about how truck drivers deemed essential workers are being treated when they cross the border, not having access to washrooms or restaurants, and some just being made to stay in their trucks.
We are very concerned with the need to continue essential services, and that includes obviously supply chains that are so important for keeping people fed, to keeping people with the medications they need through this difficult time. We continue to work with folks at the border to ensure that the smooth flow and respectful support for these essential workers happens at the same time as we're ensuring safety for our citizens. It's always a challenging balance to establish, but we need to keep working to try and make sure that we can continue to get these essential goods while people are taking risks by continuing their essential work.
Bonjour, Monsieur le Premier Ministre. Christian Noël de Radio Canada. J'aimerais revenir sur ce que vous avez dit.
Christian Noël, Radio Canada. I'd like to come back to what you said a couple of minutes ago. You're working on different scenarios involving the Army, especially for Montreal. Could you specify on what scenarios you're working on and why? Since the beginning, we are preparing for different types of scenarios. And where COVID will hit harder, or where things are going well, some regions, some pockets have more cases. Our armed forces will always be there to help Canadians. I know that they had assistance scenarios in case of flooding in the spring. We'll continue to work with the regional authorities, the provincial authorities, with the City of Montreal, with all cities throughout Canada to respond to emergency situations that could rise. But we're not going to make any hypotheses. If we have to take additional measures, we are going to take things one day at a time. We're going to prepare for every scenario. You don't want to talk about it, but does this apply only to Quebec? Are there other provinces that are having conversations with you to call in the Army? We'll always respond to the needs raised by any province if they're asking for federal assistance. I don't want to speak to what province might or might not ask for assistance. We will be there to provide help to provinces, to provide help to Canadians so that people can remain safe during these tough times.
Thank you. We have time for one more question.
Ashley Burke, CBC News. Prime Minister, there are towns and there are cities across the country who are preparing arenas and community centers to prepare them into makeshift hospitals if needed. What does that tell you about where we are in the arc of this crisis? And as well, what does it say to Canadians about their hospital's capacity?
I think it's a message that we are preparing for every eventuality. We are hopeful that the behavior that people have engaged in will keep numbers to a manageable level of people affected who need hospitalization, and that is why we are working extremely hard to encourage everyone to stay home and to not risk spreading this virus further. That is how we will control the spread. Our healthcare systems are designed to function close to capacity in normal situations. Day in and day out, we need our hospitals to be able to handle normal surges, whether it's during flu season or after an accident or an illness. We have a health system that works pretty well to handle the needs in regular times. These are not regular times, and therefore it is appropriate and necessary that we look at how to expand our health system to handle unprecedented numbers in an unprecedented crisis. And I want to commend all the people who are looking at alternatives that we all hope we won't need, that indeed we will not need if people continue to take seriously the directives and stay home and self-isolate. But it is simply responsible for us to be thinking about worst-case scenarios and preparing for them just in case we do need them.
There's been a huge wave of snowbirds and spring breakers returning to Canada, and there's a potential that we're going to see a surge because of that. How prepared is Canada's healthcare system to deal with that surge?
This is why we are impressing upon everyone how important it is that if you return from travel, that you isolate for 14 days. It is extremely important that everyone isolates. And there have been a few questions recently about, well, does that mean I can go for a walk if I keep separate from people by 2 meters? It's very simple. According to Public Health Canada, you can go for a walk unless you have tested positive for COVID-19, unless you have symptoms of COVID-19, or unless you have returned from overseas or outside the country within 14 days. And when you do go outside, make sure, if you don't have any of those three categories, make sure that you are keeping your distance. Don't gather in groups in parks. Keep those distance. And if you are in quarantine or self-isolation and you need some fresh air, open a window or step outside onto your stoop if that's a private place. But really, we need people to be abiding by the rules that public health has put out, particularly people who've returned from travel outside the country.
But can the healthcare system actually deal with the surge?
We are ensuring that we're able to deal with this surge. People are putting emergency measures in place, but we are hoping that there won't be a surge because we have seen other areas overwhelmed, even if they have strong healthcare systems. That's why it's so important that everyone abide by the instructions given. Merci tout le monde. Bonne journée.
Thank you, everyone.
That was Prime Minister Justin Trudeau updating Canadians on the COVID-19 crisis. Let's go back to Mike Couture in Ottawa. Mike, not just a media conference this morning. It felt like the Prime Minister was addressing Canadians directly and addressing some of the country's most vulnerable, in particular seniors and youth.
Yeah, and trying to help them understand that, look, we've got your backs too. This entire week we've been talking about workers, we've been talking about businesses, we will help them. But also, you know, there has been a concern, you know, friends out there who are doing health check-ins with, you know, maybe parents of their friends, and an acknowledgement to that maybe these are people that are not being taken care of. So first, let's get to that. The United Way is getting $9 million, and it's going to the United Way so that they can disperse it to other local organizations to do check-ins on seniors, to do grocery pickups for seniors and those types of things. Prime Minister Trudeau saying how important that is and making sure that that is taken care of. He also was asked about whether or not CPP would be topped up, much like some of the wage subsidies. He said they might be looking into that right now, but so far not just yet, because seniors, like everybody else, still have bills to pay. Then further to the announcement, $7.5 million for Kids Help Phone. Again, he started today by addressing kids and saying, look, I know this is difficult. You can't see your friends. You're stuck in your home with your parents. You're not going to school. If you need somebody to speak to, Kids Help Phone is there. It's a national organization, bilingual as well, and that counselors and trained volunteers, they're going to hopefully get more of them with that $7.5 million. And then $200 million for the homeless or victims of domestic violence. Acknowledging that there again is an issue. This has been talked about a lot, but possibly not by the government, where if somebody is isolated at home, stuck at home, and your home is not the safest place for you to be, then that is a huge issue. And hopefully they're hoping that that $200 million will go to help that. And was speaking to somebody during this press conference, I was texting with somebody from the Prime Minister's office and ensuring that this is not part of the big announcement that they've already put out there, not the billions of dollars they've already announced. And I'm being told this is new money. So this is a new announcement, not something that we were expecting this weekend, but obviously something that this government feels is important going forward. Now that they've sort of looked last week at the broad look at, you know, businesses and Canadians, they want to look at sort of micro-targeting some of these other groups that still need this type of help. And, you know, when you said speaking directly to people, I think right at the end there, it was interesting how he kind of turned into, you know, doctor-in-chief almost, or at least medical specialist-in-chief, saying, look, these are the rules. If you, you know, have come back from somewhere outside of Canada, 14 days self-isolation. If you don't have any symptoms, you can go for a walk, but don't forget, keep that distance. It was interesting that Patty Hajdu, the health minister, last week, sort of to try and help people understand, look, if you don't get what 6 feet or 2 meters is, picture the length of a hockey stick. That's how far you got to be away from each other. Very Canadian analogy, obviously. But the Prime Minister clearly feels that maybe people aren't getting the message enough, or potentially because people are hearing from the different health agencies in BC and Ontario that there is a bit of a bending of the curve, maybe not a flattening or planking of the curve, and worried that people will get into this false sense of security. I think for him personally, even sort of noting that, look, his wife, Sophie Gregoire Trudeau, is out now. She's fine. Now she's actually out of the house. She's going to Harrington Lake, which is north of Ottawa here in Quebec, where is the, you know, the summer cottage, so to speak, of the Prime Minister and his family. So she's going there with the kids. But interesting that somebody asked him again, okay, so does that mean that your clock now resets again, your 14 days? And he said, look, what we've done is because she only stopped presenting symptoms a couple of days ago, we've essentially restarted that. But he also noted, we are asking Canadians to stay home and work from home. So look, I'm going to do that too. I'm going to practice what I'm preaching. And he says it's remarkable what you can get done at home just through the phone and computer. So it looks like his clock is going to be not 14 days, but just inside of 14 days that we'll continue to see him outside Rideau Cottage giving these press briefings. Colleen.
And Mike, another issue that caught my attention was something that I would be concerned about if I were unemployed right now, and that is helping people access these benefit packages, and that includes younger people who've lost their jobs and seniors. It's a really cumbersome process with details that we're still waiting for. And he admitted that, well, we've never done this before, so we're kind of doing our best.
Yeah, and trying, I guess, to sort of plead with Canadians, please be patient. And I think, you know, earlier in the show, before he spoke, Mercedes spoke to it very well, that there are some Service Canada outlets that are closed. And don't forget, if you're someone on social assistance or someone who's used to going in to see somebody face-to-face, or, frankly, you can't figure out the technology, which is understandable, it can be cumbersome, or you just don't have the technology, then what are you doing right now? And that's a difficult thing that the government has to really address. And I think the Prime Minister is sort of underlining that today and sort of saying, we are doing our best to do this as quickly as we can. And as I'd mentioned earlier, that the Finance Minister is saying this system was not built for the stress and strain it's about to go through. I really think that when it's finally up and running, we will see exactly how it goes and if it goes well. I don't know if they think that it actually will go well, to be honest. I think they're crossing their fingers, hoping for the best, but worried that there will be hiccups, there will be computer issues, and that it will cause more of a delay for people to get the money in their pockets.
Mike, we're going to stay with you. We're also going to bring in our other correspondents, Mercedes Stevenson at home in Ottawa, and Redmond Shannon joins us from London. Mercedes, let's talk to you first. We've been waiting to learn about support for seniors. The Prime Minister promised $9 million to support them through the United Way Canada New Horizons program. Does that go far enough?
Well, I'm already getting emails from seniors who are saying, well, what about the fact that we're losing money in our investments? And what the Prime Minister said about that is that they are still looking at other options for seniors. What that would provide is health checks for seniors who are in a vulnerable health condition, as well as things like grocery delivery. So those who can't get out or are extremely high risk if they go to the grocery store and potentially expose themselves can have groceries delivered, especially if they're socially isolated and don't have friends or family members who are able to deliver that food to them. It doesn't do anything in terms of increasing something like the Canada Pension Plan or income support for seniors. The Prime Minister says that's because they're focusing on people who have lost their jobs first due to COVID-19 and supporting them, and that they are then looking after that about what to do. They're still really trying to figure this out, but I'm already hearing from seniors who are saying that they were hoping for something more. Obviously, I expect there's going to be more announcements in coming days. Whether or not there's substantial money is the question, but even just, the government putting money in might be reassuring, but this is such a difficult time for our seniors, Colleen, because at the best of times, many of them are isolated. Those who are homebound and don't have people who are able to come and visit them, and when you can't anyhow, you see pictures of people on social media waving from outside. I have a personal example. Today is my dad's 92nd birthday, so happy birthday, Daddy, I love you. But I'm here in my condo because I can't go to Calgary, where he lives, to visit him. So there's a lot of changes, and those changes are particularly hard on our seniors who are already often struggling with so much.
That's absolutely true, and happy birthday to your dad as well. Redmond Shannon, I would like to come to you in London. Now, the Prime Minister was asked specifically about enforcement of the rules that are in place for self-isolation and physical distancing. What is the UK doing in that respect?
Well, just a couple of days ago, Colleen, I was out taking my state-sanctioned one piece of exercise a day in a local park. The park was pretty busy, but most people were doing their best to stay 2 meters apart. And may I add to what Mike said about 2 meters being 6 feet and a hockey stick. I can attest that 2 meters is actually closer to 7 feet if you think in old school measurements. That's because I am 2 meters tall. So I know this thing. So if you put me between two people, that's the distance you need to keep. However, I digress. In this park, there were a number of people sitting on park benches, and police were going along bench to bench to tell people, you're not exercising, please stand up and please go home or exercise. And a lot of people were actually objecting with the police, but the police were trying to plead with people's sense of community in terms of not laying down the law with a fine as of then, but trying to just encourage people, this is for everybody's good and for your own good. However, we've now learned, and across the UK, they have put out measures that involve fines, and fines of up to £900 or $1,600 for an individual if they fail to comply with the rules as they are now. And the rules are getting more and more stringent, just as they are in Canada, just as they are across much of Europe. So people could be, the police could be doing more than just encouraging people over the next coming weeks and months here in the UK. And that's being shown across places like Germany too, where police in a city like Berlin that is very skeptical of police given the history of East German secret police there. Police are now monitoring people's movements, telling people to move along. Berliners obviously very skeptical about that, but you can imagine as people become more and more aware of how important it is people are listening to what police are saying.
Redmond, thank you. Mike, I want to talk to you briefly about the Prime Minister's response to the question about how we're dealing with the prison situation.
Mm-hmm. Yeah, and mentioning that he is concerned about it and saying that, look, he's going to have Bill Blair, the public safety minister, address it. And they understand that it could be a source of spread. That's a big issue. So they're saying they're going to look into it just before, because I know I'm going to be wrapped up soon. Happy birthday to Mercedes' dad. Didn't want to forget to get in on that. Secondly, I have so many questions about how tall Redmond is, but I know that we can't get into that as well. But interesting that obviously it is a bit more than a hockey stick, everyone. So check that as well. It's 2 meters.
Yeah, it takes a Brit to tell us that. Thanks so much, Mike. All right, let's recap what we heard from the Prime Minister today. He spoke directly to kids and seniors today. Ottawa will provide $7.5 million towards adding more trained volunteers to the Kids Help Phone so that organization can offer more counseling services to young people. And a further $9 million will be contributed to support seniors through the New Horizons program at the United Way. The Prime Minister also confirmed help for vulnerable populations, the homeless, and victims of domestic violence. $200 million will be spent to support shelters. And he said there has been no request for any sort of intervention by the Canadian Armed Forces in any part of Canada hit hard by this pandemic. He did not say whether the federal government will take stricter steps or fining people who violate orders to self-isolate and not to gather in groups, as some provinces have done on their own. And he discussed the concerns about the vulnerability of Canada's prison population, as we were talking about. He says that Public Safety Minister Bill Blair will address that issue in the days ahead. And a reminder once again to stay home and practice self-distancing. The Prime Minister again reminding all Canadians to do their part and that we will get through this together. You can find full details on globalnews.ca and tonight on Global National. I'm Colleen Christie. Thanks for watching. We now return you to your regularly scheduled programming.
This has been a special report from Global News.
Bonjour tout le monde et merci à tous les Canadiens et toutes les Canadiennes qui nous écoutent et qui nous regardent ce matin. Nous avons en effet tous une responsabilité pour protéger à la fois notre santé et celle de nos proches. Et ça commence évidemment par la distanciation sociale. Mais j'aimerais aussi souligner et remercier le travail des journalistes dans cette salle aujourd'hui et au téléphone parce qu'eux aussi jouent un rôle essentiel pour nous informer et pour nous guider dans cette situation de crise. Sur un plan plus peut-être personnel, nous aimerions les remercier pour tous les sacrifices à la fois personnels et professionnels que les journalistes font dans le contexte de cette crise. Nous vous remercions aussi de votre patience parce que nous sommes évidemment dans une situation d'urgence et qu'il n'est pas toujours possible ou facile de répondre à toutes les questions pertinentes que vous pourriez avoir. So thank you to all Canadians watching now. We all have a responsibility to protect our health and the health of our loved ones in this particular crisis. And that starts with following the important physical distanciation measures that you have heard and that you will keep hearing, because they help protect your health and the health of everyone that you care for. Thank you also to the reporters present in this room today, as well as those on the phone. We understand that your role is absolutely essential in this crisis to inform and to guide us. And we understand also and value the personal and professional sacrifices that you are making in the current situation. Everything is going very fast. It's not always possible to provide the important answers that you expect from your important questions as quickly as you would normally need and deserve to get them. But we thank you also for your patience. Ce matin, nous allons avoir une présentation du ministre Ahmed Hussein, qui va être suivie par une présentation de la docteure Tam. Dr. Nou va être aussi présent pour répondre aux questions. So this morning we'll have a presentation first from Minister Ahmed Hussein, then from Dr. Tam, and Dr. Nou will also be available for questions and answers. Minister Hussein?
Thank you very much, Minister Duclos, and good afternoon to all of you. I want to talk about the fact that although COVID-19 is affecting all of us as Canadians, certain communities and individuals are particularly vulnerable to it. And as a result of that, we have to ensure that our response pays particular attention to those individuals. And it is in that vein that just very recently that the Prime Minister announced the additional investment of $7.5 million in funding to Kids Help Phone to provide young people with the supports that they need at this difficult time. This will allow for the hiring of more counselors to help those young people, as well as more volunteers. In addition to that, the Prime Minister also announced that the Government of Canada will contribute $9 million through the United Way Canada for local organizations to provide really important services for seniors. Les sans-abri au Canada font déjà face à des problèmes de santé importants. La crise de la COVID-19 menace d'aggraver ces problèmes. Canada's homeless population is a community that already faces significant health challenges, and the COVID-19 crisis is threatening to exacerbate those challenges already. Shelters across the country are facing additional pressures, providing Canadians with room to self-isolate, for example, while at the same time dealing with some of the challenges that are also being faced by other non-profit and charitable organizations. Challenges such as a drop in revenues, a drop in the number of volunteers available. And shelters traditionally have always worked tirelessly to provide temporary housing to those in most need of temporary housing in Canada. Today, they find themselves working under unforeseen pressures, and we can't allow them to face this challenge alone. That is why we are investing an additional $157 million through the Reaching Home program and an additional $50 million targeted directly to women's shelters. This money will be in addition to the $15 million that we rushed out very quickly in the last number of days to the most impacted communities in Canada. And the important thing about this $157.5 million investment is that it's flexible. It will allow the designated communities to use this money in response to COVID-19. They can use it for prevention and also for management of any outbreaks. This money can be used to procure personal protective equipment. It can be used to buy barriers for social distancing. It can be used to procure additional space in hotels and motel rooms in order to isolate individuals when they're infected with COVID-19. And I want to acknowledge the Public Health Agency of Canada for issuing really important guidelines to providers of services for people experiencing homelessness. This was a very important step taken by the Public Health Agency of Canada to help protect frontline staff that serve the most vulnerable in our community every single day. The money that we're announcing today will also help the shelters procure medical services and medical equipment. This money is already making a difference in many, many communities across the country. In the coming days, we will provide additional details about where this money is going and how it will be helping homeless individuals. We will continue to work with this really important sector to ensure that they have the resources that they need to get through this. Myself and my parliamentary secretary, Adam Vaughan, have been holding regular meetings with organizations that serve the homeless population directly right across our country. And I have been in nearly daily contact with many mayors from across the country. My message to those working on the front lines is this: we are here for you and help is on the way. And I also want to take a moment to thank our provincial partners on helping with housing. As you know, we acted very quickly to make sure, effective March 15th, that it is easier for Canadians to get a deferral on their mortgage payments if they're facing difficulties as a result of COVID-19. It is my understanding that all 10 provinces have now also ensured that those who have lost their jobs as a result of COVID-19 and are having difficulties paying their rent will not have to worry about being evicted. This is great news as we move towards the end of the month. And these are difficult times for us all, but the Government of Canada and our partners have your back. We want to protect everyone, all Canadians, especially our most vulnerable. And we are in this together. Merci beaucoup.
Merci, Ahmed. Dr. Tam?
Thank you, Ahmed. Dr. Tam.
Thank you.
Thank you.
In Canada, there are now 5,866 cases, including 63 deaths. In addition, at any point in time, there are many other people under investigation, awaiting lab results or not yet tested. So again, I'm trying to emphasize that even if you are not hearing of cases in your community, it doesn't mean that there are no cases or that there are no exposures waiting to happen. We have now completed tests for over 205,000 people in Canada, with about 3% of people then confirmed as positive and over 90% confirmed as negative. Of the over 5,000 cases, we now know approximately 67% required hospitalization, about 3% are critically ill, and around 1% have been fatal. Please note that this is real-time data, and this data can fluctuate as and when the provinces report this information publicly, as you've seen them do so over the course of the day. The age group breakdowns, however, are only available for a subset of cases, and this information comes from more detailed case reports, which are less timely. So at the moment, the information we have for age groups of patients hospitalized is only available for about a quarter of all cases. Yesterday, I misspoke regarding the percentage of hospitalized patients who are under 40 years of age. The correct figure is approximately 12%, but that's fluctuating around to the 9 to 12% mark. The point, though, that I was trying to make and emphasize was that younger people can experience illness severe enough to require hospitalization. So that's the message. Voici ma liste pour le printemps. Les snowbirds qui rentrent au pays doivent respecter l'obligation de se mettre en quarantaine. Vous devez rentrer directement chez vous et rester à la maison pendant 4 jours. Les personnes qui habitent en ville devraient éviter de quitter les régions urbaines pour aller dans une région rurale, puisque les régions éloignées des grands centres sont moins bien équipées pour gérer la COVID-19. Enfin, comme nous devons maintenir une distance de 2 mètres les uns avec les autres, nous devrons adapter les célébrations religieuses de Pâques et du Ramadan. J'appelle tous les chefs religieux à participer aux efforts de tout le Canada pour maintenir l'éloignement physique et nous aider à aplanir la courbe de cette épidémie. Now for my spring checklist. Snowbirds who are returning from outside of Canada must respect the mandatory quarantine now in place. You are required to go straight home and stay in your home for 14 days. Urban dwellers should avoid heading to rural properties as these places have less capacity to manage COVID-19. And given the need for all of us to stay out in our 2-meter bubble, even our most important religious observances, such as Easter and Ramadan, will need to be adapted. I ask all religious leaders to be part of Team Canada's efforts on physical distancing to help us plank the curve of this epidemic. Thank you.
Merci beaucoup, Dr. Tam.
Thank you very much,
Alors, nous
Dr.
pourrions passer, si c'est possible, aux périodes de questions.
We can move to questions now.
Bonjour. Alors, nous allons commencer la période de questions.
We'll start the question period.
Starting with questions on the phone. We have 2 questions on the phone, so we'll do 2 questions on the phone, then 2 questions in the room, and then go back to the phone if there are more questions.
Thank you. Merci. Please press star 1 on your telephone keypad if you have a question. Veuillez appuyer sur étoile 1 pour toute question. The first question is from Linda Dibb from La Presse canadienne. La première question est de Linda Dibb de La Presse canadienne. Your line is open. Votre ligne est ouverte.
Oui, bonjour. C'est Lina, pas Linda, mais c'est pas grave. Ça arrive souvent. Mr. Hussein, my question is for you about the money you're announcing for the homeless. First, maybe I lost count because there's been so many announcements. Are you saying that this 157 plus 50 is brand new today and it's on top of another 50 that you announced earlier?
Very good question. The regular federal anti-homelessness program is called Reaching Home, and that program is funded on an annual basis. And the new money that was supposed to flow on an annual basis will still flow on April the 1st. This is top-up money to help specifically with the challenges faced by the entities, the community entities serving homeless individuals, helping them with the challenge of COVID-19, enabling them to prevent the outbreak and also manage any outbreaks in that population. So in the context of COVID-19, it is new money, yes.
New on top of what I thought you announced already money for homeless and for shelters, actually, a few days ago.
This is that money, but it is new money in the context of COVID-19, and the additional $15 million that we rushed out of the door for the most impacted communities, that is on top of the money that I'm also talking about today.
Thank you, Minister. Next question, please.
Thank you. Merci. The next question is from Mia Robinson from the Canadian Press. La prochaine question est de Mia Robinson, the Canadian Press. Votre ligne est ouverte. Your line is open.
This is a question for Dr. Tam, I think. I'm wondering if you could talk to Canadians about this sort of explosion of people trying to offer homemade face masks and whether or not you think these are recommended, if there are sort of any good use of them, or if people should avoid them. And also, if you could also talk a little bit about the building of temporary hospital sites in various provinces and what kind of federal coordination is underway on that.
So on the question of masks, well, first of all, we ask that people with symptoms cover up the cough or cover up their sneezes. And so it can be with a Kleenex, or sometimes we're saying if you don't have that a tissue, then cough into your sleeve. So masks can be helpful for people who are symptomatic in reducing the spread of droplets. So that's the concept. Of course, if you're in healthcare settings, those masks are regulated by Health Canada. And so that there's a standard that people have to meet for that sort of purpose. And Health Canada has issued guidance in terms of alternatives that can be used for different those kind of purposes. So I certainly encourage people who are making masks for different purposes to consult the Health Canada guidance and their website.
Mia, one follow-up?
Sorry, I just want to clarify. These are people who are making homemade masks, sort of make sewing groups and things like that for people because it's not easy to get masks. But I'm also looking for you to talk about the building of temporary hospital sites or in convention centers and that, and if there's any kind of federal coordination or work going on with the provinces on that.
Yeah, so I'm aware that around my federal provincial territorial table with the chief medical officers that there's a lot of efforts on the ground in preparing hospitals, but also their surge sites. So this is sort of underway already within the different jurisdictions, and that is the provincial jurisdictions. Of course, the federal government can provide support as needed, and that's always open. And so there are certainly guidance what we also issue for alternative care sites.
Thank you. We'll turn to the room. Mackenzie, CTV.
Hi, Mackenzie Gray from CTV. This question's for Dr. Tam or Dr. New. A few days ago, Dr. New, you said that Canada has 5,000 ventilators right now. But when we look in the U.S., we're seeing Governor Cuomo in New York saying that potentially New York State needs 30,000 ventilators. So with your best estimations, how many ventilators do you think Canada will need throughout this crisis?
I can answer that. Certainly, the number we gave earlier was based on an estimate that was done with, sort of a look around the country at that time. And obviously, it's evergreen. At the present time, we're undertaking another inventory with the provinces and territories to determine how many, quote, ventilators we actually have across the country. In terms of scenario planning, it's difficult to say what the number of ventilators is needed because, as I stated earlier, what we're planning to do is actually prepare the system so that we will never have to have that peak sort of requirement for a certain number of ventilators at one time. As we've said, we want to flatten the curve, and therefore all the steps we're taking across the country are aimed at that. For example, hospitals are now preparing in terms of trying to empty beds by looking at alternative sites for patients who don't need that critical care. They're looking at bringing back retired physicians. They're looking at all sorts of measures to better prepare the system. But if we as Canadians, all of us, practice physical distancing, then what's hopefully anticipated is that if, let's say, for example, in a given area, you might need 1,000 ventilators. If those patients are spread over a number of weeks and months rather than within 1 week, then we won't need that many ventilators and won't overburden the healthcare system. So that's what we're aiming for.
But we're going to need more, though, right? Than the 5,000 or so that we've got right now. There will need to be an increase in what we've got to be able to deal with this.
Certainly. The federal government, we're in the process of actually purchasing additional ventilators so that we can provide surge capacity across the country. And of course, it depends. One area might need it, more than another. And so we certainly have it ready, and we're ready to deploy as needed.
Dr. Tam, go ahead if you want.
I was just going to say that we preemptively ordered an additional 600. But continues to order more. I think a little while ago there was an announcement of looking at domestic capacity of manufacturers in Canada. So we're engaging key manufacturers such as Thornhill, and those are ongoing discussions to get access to their inventory as we speak.
Next.
Hi, Dr. Tam, Ashley Brooks, CBC News. You've been talking about how there are enough medical supplies in Canada and how you're prepared, but there is a bit of a disconnect happening because we're hearing from frontline workers that they're reusing masks or they're rationing other medical supplies like masks. What is the disconnect there?
Well, I think personal protective equipment, including masks, are a really critical resource for which there is absolutely supply issues globally. So it's not Canada in particular, but globally. So which is why we're pulling out all stops to try and get access to whatever we have. And that is a process which is actively going on right now. At the same time, responding to a pandemic is also about, handling and prioritizing your most critical and scarce resources. So hospitals on the front line are practicing how they can make sure that they can reduce what we call the burn rate and not waste resources as well. So I think you're seeing some of that practice going on preemptively, because you can't burn through a lot of personal protective equipment. So it's the effort to preserve them as much as possible while we're still getting some more.
And as well, there's a lot of snowbirds that have been returning to Canada, and as well, people that were away on vacations. Are we expecting to see that surge come soon? And is Canada's healthcare system prepared for potential surge if people don't heed your advice and stay home?
I think that's a very, very important concern, and that's why I messaged today that for snowbirds, we have a mandatory quarantine on an emergency order right now, so that as you cross that international border, you're asked to respect that. And the penalties are substantial if you do not. But it's working also with local jurisdictions, because they are concerned about snowbirds and other returning travelers, and concerned that they may not be listening to that message, which is why at every level we're trying to message this to this population. And yes, I mean, with the influx of any groups of persons, whether it's from a cruise ship or from returning travelers like the snowbirds, is that we have to be really, really vigilant and do the sort of rapid case identification, contact tracing. If someone is actually staying in their home for that 14 days where the incubation period occurs, that is a fundamental public health measure, which is why you have to stay home. At the same time, of course, given the various influxes of, say, March break returnees that are still coming back, or snowbirds, hospitals are trying to prepare for that surge by essentially emptying out a lot of their hospital beds and the ICU. There's a number of hospitals that have now reduced the ICU occupancy rate by 50% already, just preparing ahead for any blips in cases as a result of those travelers.
Merci, Dr. Tam. Impérateur, on va retourner au téléphone pour 3 questions.
Back to the phone for 3 questions.
Thank you. Merci. The next question is from Philippe Vincent Foisy from Rideau, Canada. La prochaine question est de Philippe Vincent Foisy de Radio-Canada. Your line is open. Votre ligne est ouverte.
Oui, bonjour. La question est pour M. Duclos sur la situation sociale. Ce matin, le premier ministre a annoncé de l'argent pour les gens les plus vulnérables. Il y a beaucoup d'isolement. Il va y avoir des possibles problèmes là, dans les prochains je m'entends en écho, dans les prochains mois. Et une des causes d'anxiété, c'est le fait de savoir est-ce que le gouvernement va nous aider. Et je voulais voir avec vous, il me semble que c'est pas encore clair. On reçoit beaucoup de questions sur le fait si je travaille 5 heures par semaine à l'épicerie parce que je suis encore un travailleur essentiel, est-ce que je me qualifie pour les 2000 $ du gouvernement? Quand je vais m'inscrire, est-ce que le site Internet va planter puis est-ce qu'on va recevoir l'argent le plus rapidement possible? Est-ce qu'aujourd'hui, vous êtes capable de promettre aux gens que tout le monde, même ceux qui travaillent quelques heures par semaine, vont pouvoir profiter des 2000 $ et vont l'avoir dans les jours suivants le 6 avril?
Merci, Philippe Vincent, et permettez-moi de rappeler rapidement effectivement ce qu'on a annoncé ce matin. Il y a un lien important avec ce que vous avez dit. L'annonce de ce matin, c'est une annonce pour nous inviter à continuer de prendre soin les uns des autres. C'est pour les jeunes, c'est pour les aînés, c'est pour les personnes qui n'ont pas de chez soi et les personnes qui en ont un mais qui ne peuvent pas y rester. Alors, les jeunes, on sait à quel point j'en ai à la maison, je les connais bien. On sait à quel point ils vivent aussi une situation d'anxiété importante. Donc l'annonce de jeunesse, j'écoute, c'est super important. On est là pour vous et vous avez une façon d'être écouté et entendu en utilisant le téléphone traditionnel ou le texto. Pour les aînés, on sait que c'est beaucoup d'anxiété aussi, ils se sentent un peu seuls. Alors, le programme Nouveau Horizon pour aînés qu'on
New
connaît très
Horizons
bien
for
au gouvernement
Seniors is a
canadien.
program that we know
C'est un
very well
programme
here
idéal pour
in the
aider au
federal
Québec
government, and
centraide à l'échelle
an
du pays,
excellent
c'est United
program.
Way.
United
Donc de
Way
l'argent qui va aller rapidement dans les
is an
communautés
essential program. This
qui ont
is
déjà
money
des
that can
organismes
be provided
communautaires qui vont
quickly
pouvoir
through
utiliser
these
cet argent-là
sources.
pour
These community funds can be
organiser des
used
activités de
to
bénévolat,
organize
faire
volunteer
des visites
activities,
pour livrer des épiceries,
some
appeler les
delivery
aînés pour être sûr que la
services
santé
for
va bien.
groceries,
Donc,
for instance, some
rapprocher
health
et prendre soin
check-ins,
les
for
uns des
instance.
autres. Puis
It's
en terminant, avant de
important
passer
to
à votre
work
question,
on really
au
taking
sujet
care of each other.
des personnes qui n'ont pas de
To
chez soi,
answer your
on demande aux
question
gens de
about people
s'isoler
who are
chez eux.
homeless,
Il y a beaucoup
yes, there are
d'itinérants
people.
et en
We're asking
particulier dans la
everyone to
région
stay
du Québec
home,
qui
and
ne
there are
savent pas
many
quoi
people
faire
who
parce
are
qu'ils n'ont pas de chez
homeless
soi.
in the Quebec
Alors,
City
on a des
region and
organismes
elsewhere
communautaires
who
solides au
feel that
Québec et au
there's
Canada qui
nowhere,
sont
there's no way
capables
where that they can
d'aider
call
chacun
home.
et chacune
We
à
have
avoir un
community
chez soi où
organizations
pouvoir se
who
retrouver,
that
se
can help
protéger.
people
Alors, cet
find
talent de
that place
157,5
to
millions
seek
est très
protection.
important,
So
en
that
particulier pour
amount,
le
the
Québec. Et
$157.5
l'annonce
million
pour
is very
les
important
personnes
to
qui
Quebec
vivent en
specifically,
situation de violence
and for
familiale
those
est aussi très
who are
importante. Il y a des gens qui ont un
experiencing
chez soi mais qui ne
family
peuvent pas
violence.
rester
It's
chez soi
very significant
dans les
also to
prochaines
remember
semaines. Alors, pour aider les femmes en
that there's some
particulier,
people who
et on a
cannot
vu
go
des
home
cas au cours
and
des
are not
dernières semaines,
safe at home.
malheureusement, de violences familiales importantes.
Unfortunately, we've seen a
De ces
hike
gens-là
in
à pouvoir prendre
family
soin
violence and
d'eux-mêmes et
domestic
de
violence.
leurs proches. Maintenant, pour traiter de votre question plus directement, on travaille très fort dans une situation qu'on n'a jamais connue au pays pour donner aux Canadiens non seulement l'appui, mais l'assurance qu'on va être là pour les aider. Donc, il y a encore des détails importants qui ne sont pas encore disponibles autour de la prestation canadienne d'urgence. On travaille jour et nuit pratiquement pour les préparer et éventuellement les livrer, ces détails-là. Et il y a évidemment la question de la mise en place. Le 6 avril est toujours la date visée, que le nouveau portail de l'Agence du revenu du Canada va être disponible. Mes informations sont à l'effet que cette date-là est toujours maintenue, qu'on a confiance. L'Agence du revenu du Canada, Mme de Boutillier en particulier, travaille très fort pour que ça se fasse. Donc, le 6 avril soit la journée où le portail va être disponible. Mais d'ici là, il va y avoir évidemment des annonces plus précises pour, à nouveau, non seulement informer, mais rassurer les Canadiens.
En suivi, PV.
Follow-up.
Puis, à quel point, quand vous regardez la situation actuelle, l'aspect de la crise sociale vous inquiète? On a beaucoup parlé de la crise sanitaire, on a beaucoup parlé de la crise économique, mais avec cet isolement qui va se poursuivre pour encore longtemps, là, hier, on disait que ça peut durer plusieurs mois, puis corrigez-moi si je me trompe, mais on s'attend à ce que ça dure plusieurs mois. À quel point la crise sociale qui se dessine vous inquiète?
Are you concerned about that social crisis?
Il y a une urgence, évidemment, sanitaire dont on parle beaucoup. Il y a une urgence économique dont on parle de plus en plus. Et en dessous de ça, il y a aussi une urgence sociale. Et ça repose sur la confiance que les gens ont, entre autres, dans leurs institutions et dans le gouvernement canadien en particulier. Donc, ce que je dis à tous ceux qui nous écoutent, ayez confiance, on est là pour vous. Personne ne sera oublié. On travaille fort, même si c'est une situation de crise. On travaille très fort pour que tous et toutes puissent avoir à la fois une capacité de prendre soin de leur santé, de la santé de leurs proches, mais aussi du pain à mettre sur la table au cours des prochaines semaines et des prochains mois, parce que la crise va continuer encore pour plusieurs semaines.
Merci, Monsieur le ministre. Prochaine question au téléphone.
Thank you. Merci. The next question is from David Youngren from Reuters. La prochaine question est de David Youngren de Reuters. Your line is open. Votre ligne est ouverte.
Thank you. First question to Dr. Tam. Is there anything in the last 24 hours data that gives you reason to be slightly optimistic or something that makes you feel a bit concerned about the way things are going?
I think yesterday I spoke about some sort of very, very early and cautious optimism in British Columbia in terms of their growth in the numbers of cases slowing down a bit. It's still too early to tell, and I think we are watching that development very closely. Of course, a whole number of measures on the public health side were put in place around that sort of May 12 to 13 date and a week after that. So it takes a bit of time to see the effect of those measures. But I have to emphasize that Canada is a big country. And so different parts of Canada are experiencing this epidemic in a slightly different timing, and their acceleration and deceleration will potentially be different. So I'm certainly watching very closely what's happening in Quebec and Ontario in particular, but also Alberta, of course. All of these areas have had reports of community transmission. I think because of the measures put in, we have to see what will happen next. But at the same time, I have to say that together with the chief medical officers, we're still thinking, well, what more can we do right now? Because you still have to act pretty fast, even if your data has, you're still waiting for your data. But every day we're thinking about, well, what more maybe we should be doing? And that is in concert with some observations, of course, as to whether Canadians are heeding the advice. So I think that in different jurisdictions, they are looking at these measures. So you've seen some of these announcements by different areas in Quebec and also in Ontario and others that they've put in place to try and really double down on that social distancing and reduction in that sort of movement of persons as much as possible. So I still think it's a little too early to tell because we are only, at the end of March. But next week will be very, very important for me anyways, in terms of looking at those trends.
Thank you. Dr. David, follow-up?
Yeah, you say it's
Operator?
Thank you. The next question is from Joël Denis Bellavance from La Presse. La prochaine question est de Joël Denis Bellavance de La Presse. Your line is open, votre ligne est ouverte.
Oui, bonjour, merci beaucoup. Monsieur Duclos, j'aimerais savoir si vous pouvez me faire une mise à jour concernant les demandes d'assurance-emploi. Il y a eu un chiffre qui est sorti il y a une semaine à peu près où on indiquait qu'il y avait 900 000 Canadiens qui avaient demandé l'assurance-emploi. Est-ce que vous avez une mise à jour à faire à cet égard-là?
What can you tell us about this?
Merci, Joël Denis. Je n'ai pas les chiffres précis, mais nous sommes certainement en haut du 1 million de demandes d'assurance-emploi. La première chose à ajouter, c'est que c'est effectivement une situation extraordinaire dans l'histoire du pays. Le Canada n'a jamais reçu, le gouvernement canadien n'a jamais reçu autant de demandes d'assurance-emploi en si peu de temps. Et la deuxième chose, c'est que donc pour ça, il faut absolument que le système de sécurité, de filet social du gouvernement canadien s'ajuste. C'est ce qu'on est en train de faire depuis l'annonce de la prestation canadienne d'urgence pour faire en sorte que cette prestation puisse être livrée de manière plus rapide, plus efficace, plus simple, aussi plus inclusive, en incluant les gens qui n'auraient pas autrement droit à l'assurance-emploi. Et aussi plus généreuse pour beaucoup de ceux qui vont recevoir la prestation canadienne d'urgence que ce à quoi ils auraient droit autrement, ce qui, dans la plupart des cas, serait juste l'aide sociale. Alors, c'est pour ça que cette prestation a été créée pour alléger les pressions énormes qui auraient autrement lieu sur le système de l'assurance-emploi et sur Service Canada en particulier.
Suivi. Très bien. Oui, une deuxième question. Le directeur parlementaire du budget évoquait la semaine dernière un déficit frisant les 112 milliards de dollars pour l'année en cours. Est-ce que vous avez une perspective quelconque sur les chiffres avancés par le directeur parlementaire du budget?
Bon, la première chose qu'il faut constater, c'est que nous sommes dans une situation d'urgence et donc les choses évoluent très rapidement. La deuxième, c'est que c'est un estimé et comme le directeur parlementaire du budget le disait lui-même, c'est estimé et en fonction des informations qui étaient à sa disposition à l'époque. À l'époque, ça fait juste quelques jours, mais quelques jours dans la situation actuelle, c'est déjà beaucoup de temps. Et la troisième chose, c'est que comme le ministre Monod l'a dit, nous avons non seulement les moyens de prendre soin les uns des autres et les moyens pour le gouvernement canadien de prendre soin des travailleurs et de notre entreprise. Mais nous avons non seulement les moyens, mais nous avons absolument l'obligation de le faire parce que l'alternative de ne pas agir rapidement et solidement maintenant serait beaucoup pire parce que quand la situation économique va reprendre, quand on va pouvoir redécoller l'avion économique du Canada, on va devoir compter sur nos PME, on va devoir compter sur nos travailleurs. C'est pour ça qu'il faut absolument investir maintenant pour à la fois raccourcir la crise le plus possible, mais aussi permettre de faire en sorte que ce qui va suivre, la période de redémarrage et de redécollage de l'économie se produise de manière la plus rapide et la plus solide possible.
Merci, Monsieur le Ministre. Thank you, Minister. One last question from the room, and we'll call it a day.
This question's for you, Mr. Duclos. During World War II, when the government asked Canadian companies to change supply lines and build things that we needed for the war effort, we guaranteed those companies that we would purchase everything that they made to make sure that they would be made whole after the war was done. So for small businesses, medium-sized businesses, large businesses that are looking to change what they're doing right now, moving away from their existing business to building masks, gloves, ventilators, will you assure them that the Canadian government will purchase those things from them?
Thank you. That's a very important question. And the general context is, as you have alluded to slightly, is that we are in a situation of war or similar to a situation of war. And therefore, the industrial policy and the procurement abilities of the federal government are absolutely essential. And that's why just a week ago, we did announce that much of the our industrial capacity in Canada, including the procurement ability of the government to channel and to support that industrial capacity, is going to be directed towards fighting the COVID-19. Now, that requires ways of doing things with businesses that we haven't seen for certainly quite a while. And I know that Minister Annan in particular and Minister Baines and many other colleagues are working very diligently with those businesses. We mentioned a couple of them earlier. And I know that there will be further announcements on that quite soon.
But if I'm a business at home looking to think, should I change my supply lines right now, but I haven't had an ability to talk to the government, should I go ahead and do that, knowing that the government will buy the stuff that I'm making?
I think the call for help and the call for collaboration is strong and clear. So we understand that there is a lot of not only ability, but a lot of willingness on the part of our industrial sectors in Canada to be there to support the fight against the virus. So I would and we would encourage those companies to be in touch with with Procurement and Public Services Canada and with Minister Baines' office around innovation and technology and economic development to make sure that this effort, this significant effort that is already on the way, is not only coordinated but supported appropriately by the federal government.
Merci. Ceci met fin à la conférence de presse. Thank you.